Congenital muscular torticollis is a condition in which a baby's neck muscle is tight and short. Usually, it is the sternocleidomastoid muscle which becomes shortened and tighter, causing the baby's neck to twist. This condition can also be referred to as Wryneck or twisted neck. As the name congenital muscular torticollis implies, babies are born with it. They are born having one of the sternocleidomastoid muscles very short and tight, causing the baby's neck to twist and remains in a single position for a period of time. Research has proven that the condition affects the right side more than the left side, but the reason still remains unclear. There is no actual cause of congenital muscular torticollis known. Healthcare providers do not know the actual cause, but abnormal position of the baby in the womb, injury to the neck muscle before birth have been found to be risk factors that could cause congenital muscular torticollis. The latter could cause scar tissue to form and tightens the neck muscles. More often, it is the sternocleidomastoid muscle which becomes injured. The sternocleidomastoid muscle is the neck muscle that extends from the jawbone, that is mastoid process, to the clavicle, the collarbone, and then to the sternum, which is the breastbone. Through difficult birth, this muscle can be stretched or pulled, which may tear, causing bleeding and bruising within it. The injured muscle develops fibrosis, which is scar tissue, which causes the muscle to shorten and tighten, pulling the infant's head towards one side. This scar tissue formed can develop a lump, which can sometimes be felt on the side of the neck being affected. Symptoms of Wryneck or congenital muscular torticollis will involve tilting of the infant's head to one side. Infant's chin turns towards the opposite side of the head. Firm, small 1 or 2 centimeter mass in the middle of the sternocleidomastoid muscle. Infants prefer one breast always to the other. Pain to active or passive neck movements. Flattening of the infant's head in most severe cases. Congenital muscular torticollis can be diagnosed using X-ray. The X-ray checks abnormalities in the neck bones and shoulders. You can also use ultrasound exam. An ultrasound is a device that uses high frequency sound waves to determine or create pictures or images of soft tissues. And so using that ultrasound could help us to determine the nature of the sternocleidomastoid muscle. We can also use physical examination to make our diagnosis. This is where we try to examine the baby keenly to see whether the already mentioned symptoms may be present, giving us a clue, and to ascertain whether the baby's or infant's condition is really congenital muscular torticollis.